Hi, in this video we'd like to briefly talk about what is a Caesarean delivery or C-section. C-section is a very common pregnancy delivery method. It's actually quite going on the rise as of recent, especially where more doctors are trying to recommend C-section because it saves time and also reduces pregnancy trauma if it doesn't go to the vaginal canal, cervix. However, here at Antai Hospital, we have a strict policy that we don't recommend C-sections unless the situation requires it. So under situations where the mother's life is in danger, the fetus is in distress, then only we recommend C-section because it is quite an invasive, destructive procedure. So C-section is a delivery method where the mother's lower abdomen, there is a surgical incision made, usually a transverse incision. You can also do a longitudinal one. The transverse one is much better to reduce some complications. And then underneath the lower abdomen, there could be a peritoneum. We need to do an incision on that as well. And after that, we will see the uterus. And then on the uterine lower body, we will make a transverse incision as well to pull the baby out via the abdomen. This is a critical or an emergency situation because either the fetus is in distress or the mother is facing some complications and we need to quickly remove the baby to avoid a pregnancy loss. So under what circumstance do we do a C-section? Usually when the fetus is in distress, or if the fetus is found to be wrapped around the umbilical cord. This is a very common one. And C-section needs to be done quickly, otherwise the baby will run out of oxygen very quick. C-section can also be done under maternal request, although here at the hospital we don't recommend it, but you can still do it if you really need it. Another situation that requires C-section is that we've had a history of multiple C-sections. Then maybe C-section is much more recommended because if you do a vaginal birth, there could be a danger of a uterine rupture. And then another criteria is that women who have a very small pelvic outlet, where the baby might be facing difficulty exiting the cervix into the vagina, this type of patient will also require a C-section. If the baby is prolonging the labor process, if it's stuck in the cervical dilation, entering, then we need to do an emergency C-section as well. And for patients who are at an advanced age, usually above the age of 35, you also might need to do a C-section, just to be safe, to protect the mother's life and also the fetal life. So what risks come with a C-section? Usually the most common cause of death following C-section is due to post-surgical infection. So after the baby has been taken out and the surgical site has been closed, there's also a chance of an infection occurring at that site. And then sometimes this is due to doctor malpractice or giving insufficient medications such as antibiotics can cause the infection and inflammation in the area and lead to maternal death. Another risk is that there could be an increased chance of pelvic adhesions after surgery. So these adhesions, when they grow within the pelvic cavity after the surgery, this can actually affect your future fertility capabilities. For example, it might lead to some recurrent miscarriage or affects ovarian function and lead to recurrent miscarriage or infertility. These are all some few risks that may happen, but under a proper doctor, proper hospital with correct technique, can be avoided. Here at Antai Hospital, for our patients, we don't recommend C-section, only under the situation where the mother insists upon it. They have multiple pregnancies, for example, twin pregnancies, triplets. They have a history of multiple C-sections, or if the mother and child is in danger, then we need to do a C-section. We recommend our patients to undergo our specialty, which is a water birth technique. This water birth technique is much more painless, less invasive, and it allows the mother to be awake under no local anesthesia to anticipate the arrival of her child. She'll be submerged in a water tank with a specific fluid warm, and it can help her experience a beautiful journey giving birth to her child. We specialize in this water birth, and if you'd like to find out more information about this water birth, you can watch our previous video on this topic. You can also get in touch with us for more information via the website. Leave me a comment down below as well.